Hello everyone, it's Danan and this is Coronavirus Natural Options from an Herbalist. Episode 7, we're going to talk about umquilaubo today, the African geranium. But before we get started, I just want to say I'm an herbalist, not a healthcare provider. I am not giving medical advice. If you have any questions, please talk to your doctor or do your own research. So why am I talking about umquilaubo? Well, the history is pretty interesting. Way back in the late 1890s, there was a gentleman with tuberculosis who was sent down from England, who was sent down to South Africa, and there was a healer there who cured this man's tuberculosis with umquilaubo. He was so excited about it that eventually he brought it back to England in 1907 to be used there to treat TB. So how was it used? Well, the root was used in a tincture, and tinctures are a great way historically to preserve plants inside of alcohol, and so that's why medicines were made with tinctures in the past, because it was great to preserve the effects of the medicine, the actual plant itself. Usually a 1-to-5 ratio, I would think, of herb to alcohol, like most tinctures, really. So what are its modern uses? Well, in the 1990s, it was touted as a treatment for colds and bronchitis. Like I said, it can be found in tincture form, but now there's also lozenges, pills, you can even get the dried root. And it's used for general respiratory infections, tonsillitis, and common cold. Now, I haven't had any customers come and get it for herpes or gonorrhea, and I haven't seen any studies on those, so that might be something you might want to research yourself. Are there safety issues? Well, sure, of course. As with all natural supplements, you need to do your own research on this, especially if you're taking any kind of prescription medications. So there's some indication that this is an immune stimulant, which means if you have a serious autoimmune disorder like lupus or rheumatoid arthritis or others, you might want to check with your doctor before you try umquilaubo. But it's also been studied as an immunomodulator as well. So, like I said, do your own research on that. It can also slow blood clotting. So if you're on any kind of anti-clotting medications, I would caution you to please talk to your physician first. So, like I said before, you can get it in capsules, tinctures, the dried root, or even lozenges, which is really convenient. Okay, I'm going to throw out a couple of quotes from some studies here just to give you some sort of context. This one is from 2011, Antimicrobial, Antiviral, and Immunomodulatory Activity Studies of Pelargonium sidoides, which is what we're going to call umquilaubo. So, quote, following the therapeutic use of umquilaubo in modern phytomedicine for the treatment of upper respiratory tract infections, the demonstrated antiviral effects of this extract against a panel of viruses, including seasonal influenza A, respiratory syncytial virus, human coronavirus, parainfluenza virus, and Coxsackie virus, provided evidence of feasible beneficial effects in patients suffering from acute bronchitis and related infectious diseases. Here's another study. Pelargonium sidoides extract, which is what we've been talking about, umquilaubo, a review of its clinical efficacy and safety for treating acute respiratory tract infections in children. This is 2018. Quote, the antiviral effects of umquilaubo is reported to be linked to the production of interferons, although a recent study highlighted a direct antiviral effect on several viruses. Here we are again, influenza, parainfluenza, respiratory syncytial viruses, rhinoviruses, Coxsackie, and coronaviruses. So why umquilaubo? Well, it does have a history of safety. It's been used in Europe now since 1907. It's been studied as an antiviral, also an antibacterial, which don't hurt, right? It works on different ailments and it's inexpensive and easy to find too if you're ordering it online. So there's another option for you. Thank you so much for watching. I'll have a few more coming up. Remember to stay safe, but don't panic. Everything's going to be okay. If you have any questions, say hello either here or on the website, and feel free to subscribe and give me a thumbs up. I'd really appreciate it. You can always go to sweetheartalabama.com to find out a little bit more about my shop and how I started. So thank you very much.